We will let you know as soon as we do. To talk about how to make the public system work, we're joined by Shirley Douglas. She's the national spokesperson for the Canadian Health Coalition. Shirley, all the talk at the First Minister's Conference is about money. It's clear the Canadian public wants a well-funded system with timely access. But is money the solution? Is that what's needed?
Well, I think you have to have a money base. We have to hear what that's going to be. But I don't believe it's the only thing. I think it's a very complicated thing we're trying to do. But I would agree they have to start with the money.
Shirley, let's talk about your father, the founding father of Medicare, and this is the centenary of your dad's birth. When he created universal Medicare, what were his intentions? Do you know if he intended it to cover everything it does today, or did he expect to look like what it does today?
Yes, and more. A speech I have of his that was made in '77, when he talked about pharmacare, dental care. He always planned on it being a very large and totally covered.
So it was always intended to cover absolutely everything and not just trauma.
Yes. The thing that was different in his day was that the planning was very beautifully done. It was slowly done. It was thought through. People were brought into the province that could really help direct the healthcare system. And then when progress was made, that was adapted throughout the province. It wasn't what our problem now is, that we've let things slide so badly.
You know, I think, and we all think, that the biggest concerns we hear from Canadians these days is that they're worried about access to Medicare when they need it. You yourself are just recovering from knee surgery, which is normally a long wait list, could be as long as 14 months. Did you have that kind of experience?
Well, I was trying to keep working, and so I wasn't pressuring anyone to take me in too early. But some people have to get their knee done faster than others. Some people are in very, very bad shape. It can't be, we can't let this happen. We have to figure a way that people have timely access to health care.
Do you think that there's a solution?
There is always a solution if you have enough people who really have the will, who care to fix it. And I've noticed over the years how much carelessness has been allowed by different governments, and actually it wasn't even careless. People have allowed the healthcare system to fail. A lot of people in businesses that were going to come into Canada as healthcare providers, healthcare insurance companies, we're saying we can't ever come to Canada and say, let's get rid of healthcare. That won't work. So let's make it fail. And then when you fail, we'll say, what a shame, because it was such a good idea. But it's just simply too expensive and it's unsustainable.
All right. Well, that's a conversation, a discussion we'll be having for quite some time. Thank you so much for talking with us today.
Thank you very much for having me.
Shirley Douglas now for some healthcare facts. Private and public healthcare spending in 2003 totaled $121.4 billion. That works out to around $3,395 per person. And as you can see, there is a shift in spending between the two sectors. In 1981, 75% of healthcare costs were paid by public funding compared to 71% in 2001. The public sector picked up 25% of the tab in 1981, and that number increased to 29% last year. Now, to hear the benefits of a privately funded system, we're joined from Vancouver by Dr. Brian Day, who's with the Cambie Surgery Centre. Dr. Day, thank you very much for joining us this morning.
You're welcome.
You had the opportunity to hear Shirley Douglas speak. She's a staunch proponent of a public healthcare system. Now you have your own private clinic. What are your thoughts? Did anything she say resonate with you this morning?
Well, a few things. First of all, I noticed you didn't answer your question about how long she waited for knee surgery. And one of the problems in Canada is we have a system in which influential people and rich people don't actually have much of a problem with waits. But the thing that I find frustrating is to listen to the Premier's conference with the First Minister's conference here, and there is no discussion that I've heard on how to fix the system. It's all about putting more money into a system that has failed. And the basic problem we have here is we have a monopoly provider, a state-run monopoly provider, Monopolies are not good for consumers, and there are solutions out there. The problem is there's been a strategy by people like Shirley Douglas to focus on the United States as the alternative. The alternative is there for all to see in Europe, in France, in Germany, in Switzerland, in Belgium, in Luxembourg, in Greece. There is a universal health system which is supplemented, where necessary, by a non-government funded parallel system, and it works. And it works. There are no waits in the public system.
Well, what do you say to those, however, who fear that the universal system in particular will primarily affect those who can't afford anything?
Poor people in France, in Switzerland, in Germany, in the countries I mentioned, get exactly the same health care. They do not wait at all for an MRI, a hip replacement, or heart surgery. And here, if we had an education system or a law enforcement system that was one of the most expensive in the world and wasn't working, and we knew that there were systems elsewhere that worked, we'd go and look at them. But for some reason, we focused on this single-payer monopoly. And just like you could use all of the arguments people use against any private option to justify having only the CBC as the media outlet for the country.
Well, let me ask you this. If you were attending the conference this week, if you were one of the premiers, what would you be asking for?
I'd be saying, get on a plane instead of sitting around in Ottawa. Send some people on a plane over to Europe and let them talk to the patients, the doctors, and the administrators over there, because there are systems with universal health care where patients don't wait, where the health system works. Canada has a system in which patients are waiting years for hip and knee replacement, months and months, or even years for heart surgery.
So bottom line, you're saying we're not managing it properly. It all comes down to that.
It's a totally dysfunctional system that needs to be revamped, and there is no talk of that at this meeting.
There's more talk about money and not enough on what you're suggesting.
Yeah, and that was tried. That's the same discussions that were held just over a year ago.
Dr. Brian Day, thank you very much for your insight this morning.
You're welcome.
Now this